Good morning and welcome to the California Grows webinar. On behalf of the California Department of Aging, we are proud to host this session as just one of many examples of the Newsom administration and the legislature's nearly $2 billion investment over 2 years in our health and human services workforce. Today's focus is on just one segment of a comprehensive statewide strategy: direct care workers employed or contracting in home and community-based settings who are not part of the in-home supportive services or IHSS program. The California Grows initiative also includes unpaid family caregivers. Many of you know that California launched a master plan for aging less than 2 years ago. One of the 5 bold goals in California's master plan is caregiving that works. Early in the master plan process, stakeholders from throughout the state prioritized the direct care workforce and family caregiving, setting an ambitious target goal of 1 million high-quality caregiving jobs by 2030. Data and demographics make clear who provides direct care in our state and in our nation: women, in particular, women of color. Our care economy is fragile and in need of investment and prioritization. The California Health and Human Services Agency and the Labor and Workforce Development Agency share this priority focus on caregiving that works. And we're excited to bring expert perspectives to you today in advance of the release of significant new funding when the RFA for the California Grows Initiative comes out later this fall. We are fortunate to partner with 2 outstanding external experts, CellEd and Collaborative Consulting, who you will hear from shortly. I want to thank Sarah Steenhausen, the Department of Aging's Deputy Director of Aging Policy, Research and Equity, for leading our Master Plan for Aging and Direct Care Workforce initiatives since her arrival at the department in January of this year. And I am especially grateful to a key new executive on the CDA team who is responsible for the California Grows initiative and our work across departments and agencies to elevate, educate, and empower the direct care workforce. I'm delighted to now turn today's program over to Dr. Renita Polk, Assistant Director of Direct Care Workforce at the California Department of Aging.
Thank you, Director DeMorris, for that welcome and introduction. And thank you to everyone who is on the webinar now. We are really excited about this new initiative and to share information with you today about that initiative. Next slide, please. So today, I'm going to start by giving some background, just briefly talking about the landscape, what the workforce crisis is, and the opportunity that we have to move forward and build up the direct care workforce. And then I will focus specifically on CDA's Direct Care Workforce Initiative, the California Grows program. After my presentation is done, we will then hear from Lori Peterson with Collaborative Consulting, and I will introduce her when we get to her presentation. And after Lori is finished, we will have a panel discussion with some really great stakeholders that have their own kind of lived experiences and expertise on this topic. And I'm really excited to talk to them and get their perspective. And then after our panel discussion, we will have some time at the end to take some questions from the audience. So we have quite a bit to get through today, so I will go ahead and get started. Next slide, please. Thank you. So I mentioned the changing landscape, and the landscape of California is changing in a couple of different ways. Next slide. So California and Californians are getting older. And the portion of the population that is 60 and over is increasing. And you can see from these two graphs here that by 2030, about 25% of the population in California will be over the age of 60. Next slide. And not only is California getting older, but it's also becoming more diverse, specifically that 60 and older population. And you can see from the graph on this page that over time, California's 60 and over population is becoming more racially and ethnically diverse. Next slide, please. And so I mentioned I was going to talk about the workforce crisis and what that is. But before we talk about the workforce crisis, I also want to talk about who the workforce is. When I talk about the direct care workforce, who are we talking about? Next slide. So this slide is just showing you kind of a quick glance into the direct care workforce. You can see here that the majority of direct care workers are women. Almost half are immigrants, and a little more than half receive some type of public assistance. And I do want to point out that this data is specific to California. So the point that I'm trying to get at with this slide is that the direct care workforce in California, it's largely undervalued, underpaid. The majority of direct care workers come from populations that have been historically underserved and marginalized. Next slide, please. And so the need for direct care workers is urgent because of kind of the older adult population increasing, and also because of COVID. So direct care workers have been essential within the pandemic in keeping older adults and individuals with disabilities safe and from COVID-19. And their work has been essential. However, COVID has had an impact on the workforce. It's depleted the workforce. A lot of workers are experiencing fatigue and burnout, and they're leaving the workforce for perhaps less demanding, less stressful jobs that pay more. So that has caused labor shortages in the direct care workforce sector. And that's only projected to grow more dire in the future with the increasing older adult population. And I also talked about how the older adult population is becoming more diverse. And so because of that, we need to think about how do we build up a diverse and culturally competent workforce to care for a changing and population that's becoming more diverse. Next slide. So now I'm just going to briefly talk about the path forward for building up the workforce and talk a bit about kind of what the state is doing as a whole. And I won't get too much into this because I know we have some great panelists later on in the webinar that are going to focus on this, but I'll just give a kind of a brief overview. Next slide, please. So this slide is showing some of the investments that California has made into addressing the workforce crisis. In the 21-22 state budget, there was roughly $946 million put forward for training and stipends for direct care workers. And then in the most recent state budget, there's a $1.4 billion package focused on building the pipeline of direct care workers. And you're going to hear a little bit more about some of these investments later on in our webinar. And so now we are going to get into the California Growth Program in particular. And I'm going to start with some background, and then we'll get into the specifics of the program. So what you're seeing here, this is text taken from the state's HCBS spending plan, and that is the plan that the state submitted to the federal government. detailing how it was going to spend the additional funding that it received in the American Rescue Plan Act. The American Rescue Plan Act provided states with additional funding for expenditures relating to home and community-based services. And as part of that, go back to the next, thank you. So as part of that, the state, CDA received $150 million to develop a training and stipend program. And so the text that I've highlighted here, I highlighted this specifically to show you the goals and the purposes of the program, which is to improve quality of care, respond to worker shortages, prevent unnecessary institutionalization. And we want to do that by improving the skills of workers, providing them with some additional stipend compensation, and helping to retain the workers that are currently in the direct care workforce. Next slide. So this slide, I know there is a lot of information on this slide, but I wanted to show the different classifications of direct care workers that are eligible for the California GROWS program, as well as the different programs and settings that are eligible. And so again, I know there's a lot of information here, but and there are a lot of different workers that are eligible for our program. And the thought behind that is that we wanted to try and have as wide a reach as possible to be able to get to all of the different types of workers that are having that direct interaction with the older adult population. And I do want to point out that this list that you see here, this is not an exhaustive list. So there may be other types of workers or other types of settings that are eligible for the program, but these are just a few examples. And I also do want to point out the last bullet in direct care workers, unpaid family caregivers. So unpaid family caregivers will be eligible to participate in the California GROWS program. They will be able to take part in the training courses that are offered through the program. So I just wanted to highlight that for you all as well. Next slide, please. So here, I wanted to show the different components of the California GROWS program and talk about those a bit with you all. I'll start with the 5 training pathways. So we are leveraging a program at the Department of Social Services, our sister department, and they have a program, the IHSS Career Pathways program, that is providing free training courses to the IHSS worker population. And there are 5 different categories or pathways for those courses. Some are more general, relating to health and safety and adult education, and then some are more specialized, for example, dealing with individuals with cognitive impairments or complex physical care needs. But all of the individuals that are participating in the California GROWS program will also be able to take part and access the trainings offered by the IHSS Career Pathways program that's being implemented by the Department of Social Services. And the next piece, the Learning and Innovations Institute, you can think of this as a training inventory. So it will be a database that individuals, workers can go to and learn about the different training opportunities that are available to them. And the goal of this is to develop consistent, high quality and accessible training statewide. And the hope is that this Learning and Innovations Institute will live on past the California GROWS program, and that this will be a resource that will be maintained even after the California GROWS program ends. The next piece is the Innovation Fund. So this will be a pot of funding that will provide grants and support innovative approaches to training, recruitment, and retention for the direct care workforce. And I'll talk a bit more about that in the next slide. But the last piece is an evaluation. So we are working with UCSF, and you'll hear from the primary investigator, Dr. Joanne Spetz, who is working with us on this evaluation later. But I'm really excited about this evaluation because not only are we going to be looking at the impact of the program on worker retention and skill development among workers, but we also want to look at the recipients of care and look to see if their quality of care has improved. If you remember back to the slide where I talked about the purposes of the program, one of the purposes was to improve quality of care. So with this evaluation, we're going to be interviewing and surveying not only workers, but also the people that they care for, and to see if their quality of care has improved. Next slide, please. So I'll talk a bit more about the Innovation Fund now. The Innovation Fund is providing grants for new and novel approaches to training of the workforce, recruitment, and retention of the workforce. Organizations will have the opportunity to apply for funding, and that funding can again be used for administering training or or developing a new approach to recruitment or retention. Next slide. And, oh, sorry, go back one more. Thank you. So we're hoping to launch, or excuse me, not launch, we're hoping to release the request for applications for the Innovation Fund in November, so about a month from now. And then organizations will have 30 days to submit their applications, and then we'll review those over the winter, and then the plan is to then launch the program, the Innovation Fund, as well as some of those training courses in the 5 training pathways for the non-IHSS workers, to launch both of those early in 2023. So I am going to stop here now, and I want to pass it to Lori Peterson, who has been working with us and her team at Collaborative Consulting to help us kind of think through the California Growth Program and how it will be designed. And so Collaborative Consulting serves a range of health and social sector clients, including community-based organizations, health systems, foundations, associations, and government entities. And their work resides at the intersection of assessment, collaboration, strategy, and action, and helps their clients design, plan, and launch new initiatives and change efforts to improve the system of health and social care. So now I will stop here and I will pass it to Lori. Welcome, Lori.
Thanks, Renita, and thanks for the great opening too. Go ahead and let's go to the next slide. So as Renita mentioned, we've been working with the CDA team and kind of thinking through what the design of California Grows might look like. And any good design starts with quite a bit of stakeholder engagement. So I'm going to talk a little bit about what we've been doing, what we've been learning, and then where we're headed. And this is just a quick snapshot of the kind of our scope or the project scope, and starting obviously with getting some of the fundamentals in place. Phase 2, which is the stakeholder engagement, which I'll talk a little bit more about in a moment. In parallel, we were running phase 3, which is the promising practice research, which I'll also highlight in a moment. And then phase 4, which is where we are right now, which is really that synthesizing of the information, some designing and some decision making, and then coming out on the end with the potential elements for the design of California Grows. Next slide, please. So stakeholder engagement, we heard from 57 voices in a variety of areas. So if you look at the screen here, we heard from home and community-based service providers. We heard from provider associations, We heard from subject matter experts, advocacy group, and we did some focus groups with the direct care workforce. And we were really interested in understanding their perspective of what's the current landscape when it comes to training the direct care workforce within those home and community-based settings that Renita pointed to earlier in her slides. What are some of the challenges, limitations, and gaps? And then what are the practices or conditions that need to be put in place for a training and stipend initiative to achieve the outcomes of interest, as Renita mentioned, increasing job satisfaction, increasing retention, and also providing career advancement opportunities for the direct care workforce. So those are the types of questions that we engage the stakeholders. And like I said, we heard from 57 voices. This is a report that will be available on the CDA website, I believe. I may need to be corrected by Renita afterwards, but this is a report in and of itself. So if you're interested in hearing more detail about what we heard from stakeholders, please access that report. Second is we launched a direct care workforce survey, and we are still in the process of synthesizing some of this information, although we do have quite a bit of data. And as you can see, we ended up hearing from over 600 direct care workers in a variety of settings, in a variety of roles. And what we were interested in hearing from the direct care workforce is what would be meaningful to them? What topics are they interested in when it comes to training? What would be a meaningful stipend, and what would that stipend be linked to? We were also interested in hearing some of the barriers that they've experienced in the past around accessing training, as well as what are some of their preferred methods or modalities for receiving training and retaining and applying that training. So those are the types of questions we were interested in hearing from the direct care workforce. Again, like I mentioned, this will be its own separate report. Everybody will be welcome to get those survey results. At the same time, we were running in parallel, what is the literature telling us? So what can we learn from other states that are doing direct care workforce training initiatives? What can we learn from past initiatives? There's been initiatives in California and other states that we can learn from and leverage that learning. We wanted to learn a little bit about training formats, career ladders and pathways, and then different types of stipends, both from an amount and an approach side, and then some evaluation methodologies. So that's kind of the details of the engagement and research process. Next slide, please. And then what we did is we stepped back and looked at, okay, what are we learning from stakeholders? What are we learning from the research? And what have we learned through the direct care workforce survey? And we started to pull the themes and the elements across all three of those activities, I'll just say, that we've done throughout this process, and started to see where there was similarities. And then we kind of categorized, here are some potential California Grows design considerations that we learned, again, from the stakeholders and the research. And I want to emphasize, these are considerations right now, not necessarily commitments. And these considerations were really anchored in, again, the learning from stakeholders and research, but also what needs to be put in place to move closer to those outcomes of interest, which I'll reiterate are increasing the job satisfaction of direct care workers, increasing retention of direct care workers, and providing career advancement opportunities. So I'm not going to get into all of this, but I'll just I'll go over briefly. So the first one, develop core competencies as the basis for training content and career pathways. And some of these bullet points, developing for a broad range of direct care workers. As you saw in one of Renita's slides, there is a broad range that this initiative is targeting. On top of that, develop specialized competencies to build on the core. Look into and explore career ladders and lattices. Offer the ability to layer the credentials for professional development. And then really utilizing a multidisciplinary perspective, which we have done through the stakeholder engagement to help kind of think through the design of the training. Second, which is no surprise, but to make accessibility a priority. And by the way, in the direct care workforce survey, this was the number one reason, number one barrier around training being a challenge because of not enough time, because of other priorities and commitments, not being able to be paid for the time to take to go to training. And so some of these are things that we also learned: training on different times and dates, transportation or childcare support and or vouchers to support those things, coaches, so providing coaching with enrollment and retention. And what we mean by retention here is retention of the training material. So these are some elements that came out around making accessibility a priority. Next slide, please. Few other ones here. Offer a mix of training modalities that are anchored in adult centered learning. By far a hybrid of offer in-person and virtual, so online and in-person. That was by far kind of the number one way folks like to receive training. Customizing the content, making it relevant, and plenty of hands-on experience, practice opportunities. So a lot of folks talked about the value of on-the-job training. At the same time, some of the challenges of even creating the time to do that. Coaching, mentoring, and peer support also ranked very high as incorporating those elements in the design of California Grows. Financial incentives to encourage participation and retention. So a lot of folks talked about incentives maybe on the front end of training, but also in the middle and on the back end. We also heard quite a bit of offering incentives maybe at the 3-month or the 6-month mark. So once the workforce has gone through the training, tying that to some retention, staying for a certain amount of time. And then also incentives like transportation or gift cards or something like that to help make training more accessible. And then the integrate, which Renita already talked about a little bit, making sure that there's evaluation and continuous learning. So being able to kind of step back and think about what's working well in this initiative and what needs to be tweaked and refined as we think about sustainability via the Learning Institute. Next slide, please. And then the last two design considerations are around outreach. In the survey in particular, we heard a lot about the way that the direct care workforce finds out about training is from their supervisor in their place of employment. The second place was really tapping into the peer, so tapping into the direct care workforce networks and being able to really promote that this training opportunity exists. That was another thing we heard quite often in the interviews and also in the survey, is that, yeah, it's great if these training initiatives are taking place, but if we don't know about it, how are we going to be able to access it and reap the value of it? So really focused on the outreach piece. And then finally, thinking about the vast network. So if you think about the system that surrounds the direct care workforce, and then trying to tap into all of those different stakeholder types, all the way from the subject matter experts to trainers, to the employers, to community colleges, to community-based organizations, to unions and workforce development boards, tapping into those stakeholders, not only from an outreach perspective, but from a design and implementation perspective as well. So those are, again, design considerations that really came out of the stakeholder interviews, the direct care workforce survey, and the research. So last slide. Here's where we are right now. So this is probably not anything that anyone can look at for too long, but we are right in the middle, or kind of wrapping up towards the end, and taking all of those elements that I just went over very rapidly, I know, and prioritizing what are really the must do. If we're looking to achieve these certain outcomes of interest, what are the must do elements that we need to make sure get incorporated into the design of California Grows? And then what are maybe the nice to do or in the future, or no, we can't do that. It's out of the scope of this particular project. So we're mapping that out. We're also mapping out how this gets implemented within the initiative and by who, because there's multiple entities and multiple opportunities. So thinking about what are the priorities, how do we start to think about the implementation or the integration of them, and then by who? And we can go off this slide. And that is, next slide, please. That is where we are, or what we've been learning, what we've been doing. I just want to reiterate in my last couple of minutes here, if you have interest in the reports and getting a little bit more nuanced, I couldn't get into a lot of what came out of the stakeholder engagement, the survey, and the promising practice research, please get in touch and we can make sure we get you those reports either via us or via CDA's website. And Renita, I think I'm turning it back to you to launch the panel.
Sorry, I didn't realize I was on mute. Thank you, Lori. Really appreciate that. So we're going to move to our panel discussion now. Oh, and actually, I did, before I move into the panel, I just wanted to confirm that the additional information that Lori mentioned about the stakeholder synthesis and the promising practices research, we will be making that available after the webinar is over, and we can send that out to the attendees of the webinar, and we will also be making it available on our website, so you can and we'll send a link to all of that information once the webinar is over. Okay, so now we are going to move into our panel discussion. I'm very excited about the panelists that we have here today, and I will introduce them now. First we have Darcy Delgado. Darcy currently serves as Assistant Secretary for the California Health and Human Services Agency, where she oversees a portfolio that includes the Department of Aging, Department of State Hospitals, Department of Rehabilitation, and the Office of Youth and Community Restoration. Most recently, she's been leading a proposed $1.4 billion package on healthcare workforce development for the agency in conjunction with the Labor and Workforce Development Agency. So thank you, Darcy, for being here. Next, we have Lori Hansen. So Lori is a woman of many talents, greatest of which is her gift of bringing joy to people with mid to late stage Alzheimer's. Lori has been a direct care activities professional for over 20 years and trained under one of the all-time greatest, excuse me, Alzheimer's Daycare Resource Center coordinators. Lori has worked in day programs and residential programs, and she can write a song with participants on the guitar, change the engine in your car, or take you panning for gold. So she's definitely a woman of many talents. Next, we have Dr. Joanne Spetz. Joanne is the director and Brenda and Jeffrey L. King Presidential Chair in Healthcare Finance at the Philip R. Lee Institute for Health Policy Studies at the University of California, San Francisco. Her research focuses on the economics of the healthcare workforce, organization of healthcare services, and quality of healthcare. She directs the federally funded UCSF Health Workforce Research Center on Long-Term Care, which generates evidence to ensure an adequate workforce to provide patient-centered care to individuals with long-term care needs across the lifespan. And last but not least, we have Winnie Yu. Winnie is the Director of Programs and Administration at Self-Help for the Elderly, based in San Francisco. She has 15 years of experience in nonprofit program and administrative operations, leading and managing federally funded projects that impact the local community, private and public grant writing, compliance and monitoring, as well as project implementation and management. Winnie has a degree in political economy of industrial societies from the University of California, Berkeley, and is bilingual in English and 3 dialects of Chinese. So thank you to all of our panelists and welcome. We're really excited to have you here. So I want to start by talking a bit more about what I've referred to at the beginning of the presentation as the workforce crisis. And so I think especially 2 of our panelists who have some lived experiences and can talk to some of the challenges that they have seen in providing care to the older adult population. So I want to start and ask Lori, and then we'll also ask the same question of Winnie, but if you can talk about some of the challenges that you've experienced, you know, either in your own career or that you've seen some of your colleagues experience perhaps in providing care, and some of those things that have maybe we talked about earlier when we talk about the workforce crisis. So Lori, go ahead.
Hi, I'm Lori Hansen, and like she said, I've been doing this for over 20 years. I look at it in 2 parts. I look at it in the adult day health kind of eyes, and I look at it out of the eyes of someone who's worked in activities in the residential facility throughout, well, a couple different areas. The biggest thing is wages, absolutely are wages, and in both sections. I'll speak what I have observed, and for myself is likely have 2 jobs, if not 3. You're always hustling. You can't afford the basic necessities of life, and it creates burnout. And you start. This is very important work, and it takes a lot of dedication, takes a lot of training, it takes a lot of knowledge and skill. And caregiving is not seen as a value in this in our society and in the United States. I'm embarrassed to tell people I'm a caregiver. I will say activities, and that's because there exists actually a system of social stratification within the actual system itself. Whereas you have caregivers, you have activities and whatnot. And the benefit of adult day health, which I like, is that there is no separation of activities of the mind, I guess you would call it, and activities of daily living. It's a combination, because you can't just split a person in half. And what I have witnessed, not necessarily on the adult day health side of it, but I've witnessed firsthand the treatment of direct care staff, mostly Latino, within facilities. And it's not to where they're necessary. I'm not talking about like verbally abusive type of situation. I'm talking just about general attitude, pay, and it doesn't help our seniors, because the one thing that's going to help our seniors in terms of their safety, their happiness as they age, is the wages and the training that direct care staff are paid. By far, it's by far the biggest threat. And that's in terms of what I've observed in terms of training within the facilities. Granted, my experience in adult day health is much different. I was trained very, very well in adult day health. I worked in 2 separate adult day health programs, and I received training and continuing training in both. However, the residential side of it is much different. There is the training that really isn't training. You learn how to like clock in, clock out, you learn where things are. I was shown a video. I worked 6 years ago. I took a job in laundry. I wanted laundry, and I was shown a video for 8 hours, and that, wasn't very beneficial. Training and wages. That's what I see as the issues. That's all I have.
Thank you, Lori. And I think, everything that you've said kind of goes back to what I made mention of, and what I think, we all know is that direct care workers being undervalued and underpaid. But Winnie, I'll pass it to you if you have anything to add on that.
In terms of barriers, so Self-Help for the Elderly has experience providing many years of training. We were founded in 1966. Our mission is to help seniors help themselves through a continuum of elder care services. And in that mission, in 1972, we started doing home health aide caregiver training because of the growing aging population and also the immigrant workforce. So you're absolutely right, Dr. Polk, and that 80% are women who are direct care workers, 47% immigrant, and 51% receive public assistance. So undervalued, under-resourced. And how do we provide a comprehensive approach to help support them in a model of coaching, of access? I think language access is a key, but I think in terms of pivoting services now to the virtual format, technology access to devices, to internet, culturally and linguistically accessible training that is in a flexible format that allows folks who are working, putting food on the table. And by the way, a huge shout out to all the direct care workers, paid and unpaid, on this call today. Thank you for all your hard work. And it is often quiet and unrecognized, but it is incredibly valuable. And as many seniors age, and by 2030, 25% of the population, that's, a labor shortage of 3.2 million in the workforce, serving a primarily Hispanic and Asian and people of color in the state of California, care recipients. So we need to definitely look at access in terms of linguistically, culturally accessible training opportunities, but a flexible earning model, a flexible training model, and a flexible incentive model that does not work for everyone. It depends on really the type of care training that they would like to receive, and the home and community-based care setting that they would like to receive training in. Because it's not just the recruitment of the workers, but the retention over time, as well as the prevention of injury in the workplace that helps people to have a longer work span, and also doing some career planning, right? Older adults for us starts at 40 plus. So looking at, in terms of the caregiving span of a career, where they might start and where they might end up, and some of the barriers that we need to look at in addressing training. Thank you.
Thank you. And you all are making very excellent points. So I'm glad you all are part of our panel, because this is all very great info and great discussion. But I also want to ask Dr. Spetz. So you have done a lot of research on this topic, and especially in terms of retention of the workforce and kind of reasons why workers may be leaving the direct care workforce. So would you just perhaps be able to discuss kind of some of the things that you found in your research in terms of why workers are leaving the workforce, or some of the challenges that you have seen in your work?
Yeah, I think the research that we know of points to two general areas or domains of challenge for direct care workers that inhibits their staying in the field. I'm going to put one of those challenges in the area of overall respect for the high level of skills and knowledge that they bring to their work, and a lack of respect or investment in their professional development. And that is an area where I think the work that's been done to prepare for the California Grows Initiative is been really attentive, recognizing that direct care workers have different levels of skill. They come to the work at different places, and some have personal experiences that have given them a lot of knowledge. Some of them have learned on the job. Some have moved across multiple sectors and learned across multiple places. And we need to respect that knowledge and really champion it. And a lack of respect for the skills people have is something that none of us like, nobody likes, and that's a broader cultural change that we need to think about. And so that, and you see that in the research. The other area gets into the space of compensation. And right now with the, so-called Great Resignation, we are hearing on the ground, and I suspect the data is going to support this when we have the data come in later, that there are a lot of other sectors competing for good workers that have great skills in a whole variety of different areas, whether that is their ability to do hard work while protecting their health and preventing injury, being able to interact well with a variety of different people and meet their needs, the ability to really the executive functioning around decision-making, addressing complex problems, figuring out how to solve them. Those are all skills that not only do direct care workers display all the time, but they're also skills that are desperately needed in service sectors, in retail sectors, in a lot of different sectors. And there is a need for career pathways for people in direct care, because as long as direct care workers might see that they have more of a career pathway in, say, the restaurant industry, where they could become a shift manager, they could move into leadership, they could become a trainer for other new hires. Those roles for some people are just going to sound more attractive because there's more room for growth. And that's something that the direct care field needs to build, and needs to build that, not assuming that it means that your growth automatically means you need to become an LVN, because some people actually want to be direct care workers. It's the job that they love, and they want respect for that, and they want a living wage for that, and they deserve that because they do a fabulous job for us. We could talk about other things like fringe benefits. Those are an issue. And many employers don't offer fringe benefits to people who are in the healthcare workforce, which seems a little bizarre that you wouldn't get health insurance working in healthcare, but we see that frequently. And all of those things contribute to a lot of job turnover. And a lot of people, when they turn over out of their jobs, don't even turn over into another job. They basically just leave the workforce entirely, because the whole experience can be very demoralizing. So I think there's a lot of opportunity to identify best practices, build on best practices, see what adapts well into what areas, and there is still a need to generate a lot of new knowledge to guide where we go in the future as the population with needs in these areas keeps growing.
Thank you. And you're talking about best practices, which is part of, as Lori just mentioned, part of the work that collaborative consulting is doing is helping us trying to identify some of those best practices. So I want to turn now, we've talked about kind of some of the challenges direct care workers are experiencing, but I want to turn now to you, Darcy. And so I know that, the state as a whole is putting forward a lot of different initiatives. So not just the California Grows program, but other initiatives across kind of different departments and agencies. So I wanted to ask if you could kind of speak to some of the ways that California overall is looking to address some of the issues that we just spoke about.
Yes, no problem. Thank you so much, Dr. Polk, and to the panelists, my fellow panelists, Lori, Winnie, and Dr. Spetz. It's just so important to hear your perspectives and to hear what is happening on the ground, because I think that one of the problems that the state always faces is really not getting that clear, like straight to the point info, the way Lori delivered it, which is training and wages. That's what I need, and so to really be able to communicate that in a way, I just really appreciate it. So I'll talk a little bit today, and Renita, as always, cut me off because Lord knows I could go on and on, but talk a little bit today about some of the efforts that are happening at a statewide level, and really in hopes that this is more of a dialogue, because we at the state have these ideas, have these initiatives, have these programs that will be in development over the next few years, but really rely on folks like you, the 178 participants that are on the call today, to tell us, hey, that's a great idea. Let's double down on that effort. And that second or third thing you mentioned, in my opinion, isn't really going to push forward and bring about change in the way that we want to. So really, I'll talk a bit today about the efforts that are happening at the state level, but hope that it can be a continuous dialogue to get feedback on what some of these plans are. So the first I will say is just point to drive home is just recognition at the state level of how much of a crisis that we are in right now. You know, when I hear Dr. Spetz talking, we hear often now that there are direct care workers who are because of the price of gas, because of the cost of living, because of all of the economic factors that are weighing down on people, that are oftentimes taking positions in retail, in fast food restaurants, because of a higher wage and opportunities to move up. And so at a state level, we are recognizing the need to really invest funding, energy, and resources into the direct care workforce and the workforce across the continuum of health and human service activities. And so while it was amazing to hear about the GROWS program, that is one piece of a bigger puzzle of $1.4 billion over the next 3 years that is being invested in the workforce specific to health and human services. And so I will touch briefly on some of those other pieces, because I got a feeling there are some people on the call who have connections to other aspects of the workforce that we're talking about, and also to acknowledge something that Winnie and Dr. Spetz both brought up, which is the need for lattices, career ladders, to give folks the opportunity. Yes, there are some direct care workers that love the position that they're in and have no interest in becoming a CNA or becoming an LVN or becoming an RN. But for others, maybe, you know, after their children get a little bit older and go off to school, would love the opportunity to engage in a training program or an opportunity where they can advance their training and also potentially increase the potential for wages to bring into their family. And so I will just briefly touch on within the large workforce package, it's not just Health and Human Service Agency. There is also our sister agency, the Labor and Workforce Development Agency, that has funding opportunities specific in the health field. And so the first that I'll talk about, which is probably one of the most exciting for me, is the opportunity for community health workers and promotores who have been in this field providing a lot of the similar services and positions that are actually quite fluid with a lot of the direct care worker services that are provided. And so a good chunk of money that is going to be going out to seed training programs for community health workers and promotores. In addition, we're looking to fund nursing initiative programs that really look at the full pipeline, the full scope of the kind of career journey of a nurse. Because frankly, it's for a lot of nurses, their journey starts in the direct care workforce realm, and starts even sometimes in the high school education programs, exposing individuals particularly interested in increasing the diversity. So targeting some of the brown and Black communities and really trying to infuse funding into their high school, community college programs to lift up those who are interested in the healthcare profession, and potentially earn and learn models where folks are able to have positions in a direct care workforce slot, where they then can proceed and progress through trainings and still receive pay while they are going through those training models. Those type of wraparound apprenticeship models have really shown to be quite effective in lifting up large groups of individuals into higher paying positions. And in addition to, the community health worker piece, promotores piece, nursing initiatives, there is just a huge breadth of funding opportunities available. So we're hearing from Department of Aging today, but I will also say If you haven't, please sign up for the Department of Healthcare Access and Information. We call them HCI. HCI has so many funding opportunities that actually overlap with a lot of the things that Dr. Polk is talking about today. And to be on their listserv to understand when there are funding opportunities that come up, I will acknowledge that the state we need to do a better job of making sure we're communicating out these funding opportunities. And so any suggestions for that, please throw them in the chat or message them to me directly, because I do think that oftentimes the people in the programs who need the funding the most just aren't aware, because they're so busy doing the job of serving the individuals that they need to serve that it's difficult to be keeping track of all the funding opportunities that are there. Sorry, Renita, I told you I'll just talk on and on, but I'll pause there for a second, but just try to summarize by saying a huge amount of respect to all of the direct care workers that are on this call, and those that support direct care workers and unpaid family caregivers, because they really are the backbone of the services that we provide to some of our most important Californians and most vulnerable Californians. So one, recognition, and two, a lot of funding opportunities, and hope that we can, again, if there is feedback, to please reach out to try to give us some perspective and insight as to what's happening for you on the ground in some of these positions. Thanks, Renita.
Oh, no, thank you, Darcy. And I think thank you for kind of giving us, kind of zooming out and giving us the wider perspective of not just, what's going on at CDA, but across all of state government, because I think, a lot of the different job classifications and the different workers that make up the direct care workforce, there's a lot of interconnectivity, and, a lot of folks kind of move from one classification to the other. So I'm sure that a lot of the folks on this webinar will also be interested in some of the efforts that are going on at HCI and other departments. And it looks like we put in the chat there how you can sign up for the links, sign up for the updates at HCI as well. So so one next slide I wanted to move to. So I think both Lori and Winnie, when you were talking about some of the challenges you mentioned, training and better training for workers. So I wanted to ask you, Lori, if you would mind talking about kind of what different types of training that you would like to see, what would be helpful for you and your work in helping you grow and become a better worker.
Well, this topic is very dear to my heart. In terms of in the adult day health, and currently, as we speak, the reestablishment of our resource center would be beneficial. The resource center, which we used to have at Mount Diablo, provided an ability to have what we called observation days, where we'd have clients come in with their family member for a short period of time, and we would be able to observe and learn from the particular client in order to better serve them. That is no longer, we're no longer able to do that. It would be beneficial, for example, in my current adult day health program, to be able to, sometimes we have things on the weekends through a different program, and to be able to be paid to go and attend these different programs without having to worry about, the budget and whatnot, and man hours and so forth. In terms of what if I had a magic wand, and in terms of training the residential care staff, I think the only way you can, if you want to do it right, if you really want to do it right, it's just like you learn how to drive a car. You have an instructor, you go together in a car and you drive around town, and they tell you, oh, don't hit that car, don't do this, don't do that. You have to do it in person, and you have to observe, and you have to, you can't just, I know personally, for me, when you throw a video on or something that's, especially if it's like on a screen, I start to tune out. Especially, we're overworked, we're underpaid, we're tired, we're absolutely exhausted, especially if it's at the end of our shift. If they throw pizza at us, that's great, but it has to be, to really do it right, and especially in specifically dementia care. You have to, that's how I learned. I didn't just come in here and get thrown, a handbook. Well, I did get thrown a handbook, but and expect to read it and learn. I learned from observation and from failing, from making, a little mistake and having my my boss come over and whisper in my ear, exactly, oh, this is, and watching her do it. Because it's so, it's not like baking a cake where there's an instruction book that you can just follow. You're talking about individual personalities on the caregiver and the client side. And it requires so much skill, more skill than people even realize. And it affects so many families and so many lives. And these are lives, our clients these are people that have a story. And you have to like recognize that story. And that story can help you care for them even. And none of this just gets taught or trained in a residential facility. And you have what California doesn't, what you folks don't realize is you have a built-in training already. You have a whole bunch of adult day health programs all over the state of California that hopefully have had the same training that I received. And if you can get the direct care staff, to where they interact, they watch us in action, make sure that we're up to speed, obviously. That is the best way that you're going to train a lot of these folks. Because the reason why after 20 years that I'm still in this industry, with what I make, I'm college educated, is because of what I've gotten back from the clients and the letters I've gotten from families, the cards, the stories and the love. I get just as much from my clients as I give to them. But you don't feel that in a residential care facility. The direct care staff don't get that. They don't get that because of their lack of training and because of just the way the whole system's structured. And that's a shame, but that's how you retain them. Even if you can't raise the wages up to what we would all hope for, what they would be, you can retain them because they're going to love their job. And how you have to give them the training, you have to give them the skills to be able to do that. And the best way to do that is to throw them, into an ADH, an adult day healthcare facility, and let them, not just one time, but it has to be over so they can learn how to smile again in their job, because they don't smile enough in their job. And we smile all the time. We just don't, but that's what I suggest.
Thank you, Lori. And I think Lori Peterson, when she gave her presentation and talked about the direct care worker survey, that one of the things that was kind of high up on the list from that survey, which you just mentioned, is kind of having that like on the job, like kind of live demonstration and training. And so that was a lot of workers that replied to the survey kind of said that was one of the things that they would like to have as well. So I think you're just further emphasizing what we've learned from our survey that we've done. And so now, and also actually, I just want to say for all our panelists, perhaps I should have said this at the beginning, but if I am, directing questions to specific people, but if you'd like to add on to something that someone else has said, please feel free. So I'd like to ask Winnie a little bit more about, in your experience as an employer and working with direct care workers, have you, in your experience, have you noticed kind of gaps in training, and how has your experience been with trying to provide training to your workers and trying to help them get access to training?
Absolutely. Thank you, Dr. Polk, and thank you, Lori, for sharing your experience. I think we always have to work just like with our clients where they're at, from a person-centered care approach. We look at our employees from a strength-based approach and from their own, approach in terms of their interest and skills and availability. We have on-the-job training, and I think that is really the most critical piece, because you see it, you catch it, you train it, and immediately you see the results, and there's an immediate retention of that knowledge. If I might step back just a little bit in terms of having the staff capacity to do that, you know, when you are lacking staffing, that is a huge challenge. And even within the care field, in-home support services wages are much higher than grant-funded adult day health center, you know, budgets can afford. So that provides a challenge in terms of our ability to keep them long enough to do the training, and then for them to feel that they can make a difference in the work that they're doing, because they're tired, right? If you are working consecutively, you know, 5 days a week, because of the need, right? You might not be able to take some time off in between to care for your own family, because many care workers themselves are in the sandwich generation with an elder at home that they need to care for, as well as younger children. So as employers, we need to be flexible. We need to be understanding, provide training at times that they are available, but also provide incentives, raffle prizes, or different kind of opportunities for them to participate at their own time in their own language, and using not just text-heavy curriculum, but really with folks who might have language or other literacy barriers, to use pictures, videos, diagrams, and hands-on practice.
Thank you. And one of actually, you reminded me, you were talking about kind of rather than having, you know, text-based training and having other types of modalities of training. Part of the California Growth Program, we're working with CELED, which is a company that provides training, but they do it kind of through the different modalities. So it's not just kind of, you know, just reading a book or something, but it's and it's bite-sized training pieces that fit into the schedule of the worker, and it's through, you know, it could be through phone calls, it could be through text messaging, emails, all those different types of different modalities. So thank you for your input on that.
You muted yourself.
Sorry, I'm moving my hands when I talk and I accidentally hit the space bar. Sorry about that. But I think this will maybe our last question before we wrap up our panel. But Dr. Spetz, I wanted to ask you, so the California Growth Program, you know, envisioned as a program to provide training and stipends for direct care workers and to increase retention of direct care workers. So I was wondering if you could talk about some of the design elements that you think would be beneficial in order to meet those goals of increasing retention of direct care workers, and if there are some, you know, particularly useful design elements that you've seen in other programs and in your research that you think would be particularly beneficial to incorporate into the California Growth Program.
Yeah, it's a great question. And I think for, you know, for organizations that are thinking about applications into this program, there's a lot of different ways that programs can be crafted. What we've seen in other workforce development programs is there are some components that often seem to have a good impact. One is clearly rewarding people in various ways for education and for the additional training. So if there are opportunities to have some kind of financial recognition, job title recognition, whatever it may be that's appropriate to mark that and honor that education and knowledge is important and can be helpful with retention. You know, other things that we've seen be really useful are thinking about the offering flexibility or in modes of training, because some people, as has been mentioned, right, some people do great with digital learning. They like, give me a video, give me a little, you know, set of videos that I can watch at my own pace when I'm at home and I'm happy. Other people really need to learn hands-on or learn with other people. And I think in this kind of work, there is really nothing quite like the hands-on experience. So having the education be integrated with hands-on opportunities may be really important depending on exactly what you're targeting for your education. It might not be the right thing for everything, but I think for a lot of areas it is. We know that mentoring helps a lot. It can help people feel more confident as they're building their skills. It gives them a point person to ask all their questions that they might be too embarrassed to ask others. And also, you know, think about their longer term careers and have kind of a champion for them professionally. And, you know, to the extent that programs can and applicants can think about flexible support for people, you know, for example, if you had a training program that you wanted to do in person, you wanted there to be hands-on components of it, and you had a participant who had an urgent childcare problem or had a car breakdown or had some other kind of unanticipated problem, are there things that you can build in to help that maintain that person's ability to participate? Because life happens to all of us, and these kinds of things can become really insurmountable barriers for people who really want to expand their education, because they just run into all of these other kinds of problems and challenges. I'm sure we could come up with a million more, but I'll stop there.
Lori, I'm sorry, did you want to speak? Go
Yeah,
ahead.
just real fast. If I had my magic wand, what I envision in terms of a program looking like, in terms of really benefiting the adult population across the board, would be some kind of stipend program, to where, of course, we want them to stay at home, and my view, as long as they can, but not everybody can stay at home. We all know that, and they get put in facilities. My view, or like what I would hope for, would be some kind of program where there'd be money to allow people that are in residential facilities or board and cares, whatnot, to be able to come to adult day health, where their families, you know, they're not gonna be able to afford it, so that would be provided for. And a caregiver from the facility could come with those clients, you know, as they're regular clients. That's how you bring that training back from an adult day health to a residential facility. Because you lead by example, you learn by example. And it would be, I guarantee you that a direct care staff, if they have the opportunity to come to an adult day health with clients that are in the adult day health, that they from the residential facility, they will jump on it, because that's a day where, you know, or the 5 hours where they aren't like just changing, you know, someone's depends or, you know, pull-ups. That's where they're not just, where they're actually, you know, experiencing why I stayed in the field for 20 years. They're going to experience the fun. So if I had my way, that's how I would do it.
Thank you. So we're have roughly 15 minutes left, and I do want to get to some of the questions from our audience, but also want to say thank you to our 4 panelists, and also just want to provide you all the opportunity, if in, you know, the last, you know, 2-3 minutes, if you all have any kind of last thoughts that you didn't get to speak to earlier that you'd like to share before we open it up to questions from the audience.
May I just make a quick comment, Dr. Polk? I think to meet that 3.2 million number of labor shortage, we need to look at the entire picture of what are the available. There's so many limited bilingual certified home health aide training programs, right? And they are so rigid and structured that, you know, how many can we graduate in a limited period of time? Can we have more flexibility in terms of certifications, credentials, licensing, right? Or maybe not even licensing, or can informal caregivers, you know, do a quasi-allied health path? You know, can we be flexible in terms of industry certifications and allowing for more people to enter into the workforce? Because right now the immigrant workforce is desperate for work, but they cannot access the healthcare field without industry certifications, and linguistic, technology, cultural barriers are in the way. and we have an aging workforce that has the language skills to meet the care recipient needs with a system that is very much structured toward a post-secondary, educational model, which it doesn't allow for entry-level workers to really be able to enter and then get the credentials they need to stay in the workforce. So that would be really helpful if we can look at any possibilities for modifications or innovations in that area.
Thank you. Yes, that's very important. And our other panelists, any kind of last thoughts that you would like to share? Okay. All right. So again, thank you to our panelists. Really appreciate you all taking the time and to speak with us. It's been a great discussion. I'm sure we could keep going on and on, but I do want to take some time and open it up for questions from the audience. So now we are going to open it for our attendees. If you all have questions, you can either submit your question in the Q&A or you can raise your hand. And it looks like we already have one person who has raised their hand, so we'll start with them. Gray Wilking, if you can go ahead and ask your question. Thank you.
Hi there. Thanks, Dr. Polk. Can you hear me?
Yes, we can.
Perfect. So I asked this in the Q&A and was asked to bring it up during this portion. So my question is, how will the agencies, providers, care agencies, et cetera, employers be notified of the opportunity to apply for the grants? Is there going to be like an email blast would it go to everyone that's on some sort of registry? The context for me is I manage the MSSP and HCBA programs in my county. So I'm wondering if it's partly my responsibility to reach out to the providers in my area to make sure that they know about this opportunity.
Thank you. That's a great question. So we're using kind of a variety of outreach methods. But so, for example, you mentioned MSSP. So we are, for example, we're going to be doing emails to our CDAs and MSSP networks that we already have existing relationships with at the department. But and I will also say, if any of the attendees listening have ideas for ways that we can outreach and network, please feel free, let us know. And you can see on the screen that our email address is up there. So if you have thoughts, comments, questions, you can also email us there. So yes, we will be sending out kind of email blasts. There will be a website that should be up within the next week or two that will have more information, and we will again send all of this information to everyone who is attending the webinar today and everyone who's registered. And so that's another way that we'll be distributing information about the program. But yes, those are just a variety of the ways that we'll be distributing information, as well as it being available on the website. Hopefully that answered your question.
Thank you.
Yeah. And let's see, I'm gonna see if we have a question. I'm looking in the Q&A. So there's a question, we mentioned that family caregivers are eligible to participate in the program. Are they eligible for stipends when participating in the training? So unfortunately, the family caregivers are not eligible to receive the stipends. However, they won't have to pay for the trainings. The trainings will be free of charge for the family caregivers, but unfortunately they will not be able to receive those stipend payments. Great, let's see. Looks like we have Jane Crystal. You can go ahead and ask your question.
Okay. Okay. Thank you, Renita, and all. Can you hear me?
Yes, we can hear you.
Okay. Yeah, I've been became aware of about a year and a half ago of the Wisdom of Trauma film, and I've been trying to share that with the state and with the governor, awareness of that, because I just feel like it could help shift transformation. And then I became aware of the collective healing or the collective trauma summit with Thomas Hubble, which is happening for another year right now. It's like a 10-day period. And, he's in Israel, I think, or Austria, but it's a global effort. And he wrote a book a number of years ago on healing collective trauma. And his focus is individual, collective, and ancestral healing. And I just think that could be an important piece for familial caregiving training, perhaps. Yeah, just how can we, recognize and support each other's strengths, and and even and I also am a mental health advocate, so I'm trying to, how do we focus on our abilities as a disabled community, and our gift, and gratitude for if we're receiving Medicaid or financial support, economic support from the government, and our caregiver is not. And, it's, yeah, and I just mentioned in the chat just how, we have limited emotional capacity and limited emotional resources. And we need those for self-care, to recharge, to have something left for our family, for our children. And yeah, so those are just a few thoughts I had.
Yeah, and thank you for mentioning that. And one thing I want to point out is particularly for the innovation fund piece, and we're still trying to think through this a little bit, but for the applicants for the innovation fund, we want to have them address specific categories of core competencies. And so one of the ones that we're thinking about is workers and kind of dealing with the emotional aspects of the job. So not just kind of the physical aspects, or, how to, use a lift and help move a patient, but also dealing with the emotional aspects of being a direct care worker. So that is definitely important in kind of mental health for our workers. So that is another focus that we are looking to address. So I see we have, I'll go back to the chat now. Looks like we have a question. Actually, this is a question for Darcy. So it says, everyone here has mentioned wages as a huge issue. Does the state have any plans to address increasing rates for home health aides, LVNs, CNAs, et cetera? And there's a second piece about how will CalGROWS address this issue. I will, before you answer, Darcy, I'll just talk specifically about CalGROWS. So our program, CalGROWS, it will not address increasing wages specifically for direct care workers. The program will be providing stipends or incentive payments for workers, but addressing wages is outside of the CalGROWS program. But I'll pass it to Darcy to maybe talk about some of the other initiatives in California.
Right, great. Thank you, Renita. So I will acknowledge that it not just in this conversation, but in many of the conversations when we're talking about the health and human services workforce, be it talking about CNAs, direct care workers, or if we're talking about kind of peer support workers or behavioral health specialists, like a lot of times the conversation comes back to wages. I don't have like the silver bullet that's going to say that, you know, we're able right now to establish a wage base the way other classifications and other arenas have. Not to say that that's off the table, but I will say that the more that we are able to engage in that discussion, especially with our partners from the Labor and Workforce Development Agency. But I will say what is in the purview of Cal HHS, which does impact wages tremendously, is the process that falls under Department of Healthcare Services and the reimbursement rates of the provision of some of the services provided by some of the classifications that were discussed, and how the managed healthcare plans are reimbursing for those services as well. And so unfortunately, I don't have an answer that says, yes, in 6 months this is the wage floor that is being established, but I can acknowledge that those conversations are happening. And I think that folks at the state level are, you know, open ears about how we can collectively make something like that happen, and that it will necessitate a lot of these different stakeholders, be it employers, workers, and the state, to come together to try to help solve this. Because you know, if we're not answering the question about wages, oftentimes we're, you know, just spinning. We're in that hamster wheel where we're putting a lot of effort towards other aspects of the workforce to no avail because of the absence of a base wage salary for a lot of these professions.
Thank you, Darcy. So we have another question in the chat that I wanted to answer, but I'll read it. We heard about 80% of the caregivers being women, as well as public assistance recipients, immigrants, etc. Many of these workers are older as well. How do we ensure older workers' needs are met? For example, training on how to limit injuries, as well as recruit additional older workers in the future? Thank you, that's a great question. So a couple of things I'll speak to in answering this question. First, you know, some of these things are issues that we are hoping can be addressed with some of the proposals that we receive in our innovation fund. And so I mentioned this earlier, but we're hoping that the projects or the proposals that are put forward in the innovation fund meet certain core competencies that will be detailed in the request for applications. And so one of those would be kind of physical aspects of the job. For example, training on how to limit injuries could be one of the things that is addressed in those applications. And as well as recruiting additional older workers. So again, the Innovation Fund will be kind of funding for these different new and novel approaches to these issues. And so recruiting additional older workers, for example, could be the topic of one of the projects that's proposed for the Innovation Fund. So I'm seeing in the chat and hearing from questions from folks that there are a lot of kind of exciting ideas that folks have about different types of training that can be done, how we can address certain issues. And so we'd love to hear all these thoughts, and hopefully some of you and your organizations will submit applications for our Innovation Fund where you can address some of these issues. And so I think looks like I'm looking in the chat and I don't see any additional questions. So I think then if there are no other questions, we can wrap up our webinar. But Before we do that, I just also again want to thank our panelists, thank Lori Peterson, Director DeMorris, everyone who has contributed to our webinar today. Thank you all. I really appreciate you all being here. And I want to thank the attendees today. Really appreciate all of the great questions, all of your input, insight on these issues. If you have additional questions, you can email the email address that is on the screen right now. And if you, again, any questions that we weren't able to answer today, you can email us. And lastly, just want to, again, point out that all of the information, the slide deck that you saw today will be sent out to everyone who registered for the webinar. And we will also be sending out some additional information relating to some of the things that Lori Peterson spoke about, specifically information regarding that stakeholder engagement, as well as the best practices research. So again, thank you all for being here, appreciate it, and hope everyone has a great rest of their day. Thank you.